Hello, I am Dr. Suraj Chiraniya, hematologist and bone marrow transplant physician practicing in Mumbai. Today we will discuss the introduction part of acute lymphoblastic leukemia. Acute lymphoblastic leukemia is a type of blood cancer. As name suggests, it arises from a type of white blood cell called as lymphocyte. Lymphocyte is an important part of the immune system of our body. If we see the derivation of word acute lymphoblastic leukemia, first word acute means it develops rapidly, so that the symptoms also develop very rapidly. It is differ from chronic, where disease is present inside our body for a long time and it progresses to show symptoms slowly. Second, lymphoblastic is a early part of the maturation phase of the lymphocyte. It suggests this cancer happens in the lymphoblast phase of the normal cycle to the lymphocyte. Third part is leukemia. Leukemia is a word for a blood cancer. Blood is a tissue, and tissue is a group of cells which in unison perform some function inside our body. Acute lymphoblastic leukemia, the epidemiology is, if we see, there is no obvious cause in majority of patients, but in some subset of population it may be secondary to a Down syndrome, some environmental or some occupational or chemical hazards. Usually this cancer happen in the young age, but it can be seen in adult as well as older generation. The symptoms of acute lymphoblastic leukemia is mostly because of crowding of these lymphoblast. These are formed due to some mutation in the maturation phases of lymphocyte. So these cells proliferate very rapidly, exponentially, so that the production of hemoglobin and platelet decreases, leading to various symptoms of anemia, infection, and bleeding tendencies in such population. Usually, the diagnosis of acute lymphoblastic leukemia can be done by performing bone marrow test. In bone marrow test, we do aspiration, biopsy, and immunophenotyping to see which type of acute lymphoblastic leukemia is present. Usually, this acute lymphoblastic leukemia is of two types: BALL or TALL. This can be easily identified after doing this immunophenotyping of these bone marrow cells. Sometimes we do lumbar puncture to see whether it is progressed to the brain or not, and genetic and molecular tests to know the exact cause, what defect has led to this cancer. The treatment part is exhaustive. It takes 2 to 2.5 years for completion of treatment. Usually, we finish treatment in various phases: induction phase, intensification, consolidation, reinduction, and maintenance. These are various phases. The treatment options ranges from chemotherapy, immunotherapy, targeted therapy. In high risk cases, sometimes with MRD positivity, we recommended transplant as well. The most important and challenging part for patient education in ALL is knowing the disease, identifying the symptoms, understanding the disease biology, and treatment. As this treatment is long and exhaustive, so that they should able to identify the symptoms and side effects of the treatment, so that they visit their primary treating physician on the onset of these symptoms at the earliest. So that's all for today's video for introduction of ALL. Every point we will elaborate in further videos. Till then, stay tuned, stay informed. Thank you.